A grim reality unfolds as the Marburg virus emerges in Rwanda. The world watches with bated breath as a new threat emerges from the heart of Africa. Marburg virus, a deadly relative of Ebola, has taken hold in Rwanda. This outbreak is a stark reminder of the vulnerability of our interconnected world. The virus, known for its horrific bleeding eye disease manifestation, has already claimed lives and infected dozens. The global community must act swiftly and decisively to contain this threat before it escalates into a full-blown crisis. The situation in Rwanda is dire. The virus is spreading rapidly and the death toll is rising. The healthcare system is overwhelmed and there is a shortage of essential medical supplies. The international community must provide immediate assistance to Rwanda to help them contain the outbreak. This is not just an African problem, it is a global problem. We have seen time and time again how quickly a virus can spread from one continent to another. We must act now to prevent Marburg virus from becoming the next global pandemic. Marburg virus disease, or MVD, is a highly contagious and deadly hemorrhagic fever. It is caused by the Marburg virus, a member of the filovirus family, which also includes the notorious Ebola virus. The virus was first identified in 1967 during simultaneous outbreaks in Marburg, Germany and Belgrade, Serbia. These outbreaks were linked to laboratory work involving African green monkeys imported from Uganda.
Marburg virus is zoonotically transmitted, meaning it originates in animals and can spill over to humans. The natural reservoir of the virus is believed to be the Rosette bat, specifically the Egyptian fruit bat. These bats are found throughout Africa, which explains the geographical distribution of Marburg outbreaks. Human-to-human transmission occurs through direct contact with the blood, secretions, organs, or other bodily fluids of infected people. This can happen during healthcare procedures, such as drawing blood or providing medical care, without proper infection control measures. Transmission can also occur through contact with contaminated surfaces or materials, such as bedding or clothing.
The current Marburg virus outbreak in Rwanda is the latest in a series of outbreaks that have plagued the African continent in recent years. The first case was reported on September 28, 2024, in a 27-year-old male who had recently visited a cave known to be inhabited by Rosette bats. The outbreak quickly spread to other parts of the country, with cases now confirmed in 7 out of 30 districts. The majority of cases have been reported in Kigali province, which includes the capital city of Kigali.
As of December 6, 2024, the Rwandan Ministry of Health has reported 66 confirmed cases and 15 deaths. The case fatality rate, which is the proportion of people who die from the disease among those who are infected, is currently estimated at 23%. This is lower than the case fatality rates reported in previous Marburg outbreaks, which have ranged from 24% to 88%. The Rwandan government has taken swift and decisive action to contain the outbreak. They have implemented a range of public health measures, including contact tracing, isolation of suspected and confirmed cases, and safe burial practices. They have also launched a public awareness campaign to educate the population about Marburg virus disease and how to prevent its spread.
Section 4. Marburg's path. How the virus spreads. Understanding how Marburg virus spreads is crucial for implementing effective control measures. As previously mentioned, the virus is initially transmitted from animals to humans, primarily through contact with infected bats or their droppings. This can occur in caves, mines, or other areas where bats roost.
Once the virus jumps to humans, it spreads efficiently through human-to-human transmission. Direct contact with the blood, bodily fluids, or tissues of an infected person is the most common mode of transmission. This can occur during medical care, especially when appropriate infection control measures are not in place.
Indirect transmission can also occur through contact with contaminated surfaces or objects. This includes bedding, clothing, medical equipment, or any other surface that may have come into contact with an infected person's bodily fluids. It's important to note that Marburg virus can persist on surfaces for some time, making decontamination efforts crucial. Section 5. The face of Marburg. Symptoms and progression. Marburg virus disease typically manifests after an incubation period of 2 to 21 days. This means that a person infected with the virus may not show any symptoms for up to 3 weeks. Once symptoms appear, they often come on suddenly and are severe.
The initial symptoms of Marburg virus disease are often non-specific and may be mistaken for other illnesses. such as malaria or typhoid fever. These early symptoms include high fever, severe headache, muscle aches, chills, fatigue, nausea and vomiting, and diarrhea. As the disease progresses, more severe symptoms may develop, including jaundice, pancreatitis, severe weight loss, delirium, shock, and multi-organ failure.
One of the most striking and disturbing features of Marburg virus disease is its hemorrhagic manifestations. Hemorrhage, or bleeding, can occur internally and externally. Internal bleeding can manifest as blood in vomit, stool, or urine. External bleeding can occur from the nose, gums, eyes, and other orifices. In severe cases, bleeding can be profuse and difficult to control. Section 6. The fight against Marburg, treatment and prevention. Currently, there are no specific antiviral treatments approved for Marburg virus disease. Treatment is primarily supportive and focuses on managing symptoms, maintaining hydration, and providing oxygen therapy as needed. Patients with severe cases often require intensive care.
Several experimental treatments for Marburg virus disease are under investigation, including antiviral drugs and antibody therapies. However, none of these treatments have yet been proven to be safe and effective in clinical trials.
Prevention is key in controlling Marburg virus outbreaks. This involves a multi-pronged approach that includes surveillance and early detection, infection prevention and control, safe burial practices, and community engagement and education.
Monitoring bat populations for the presence of Marburg virus and quickly identifying and isolating suspected human cases are crucial for preventing outbreaks. Strict infection control measures in healthcare settings are essential to prevent the spread of the virus from infected patients to healthcare workers and other patients.
Traditional burial practices that involve direct contact with the body of a deceased person are a significant risk factor for Marburg virus transmission. Safe burial practices, such as using body bags and disinfecting surfaces, are essential for preventing further spread. Educating communities about Marburg virus disease, how it spreads, and how to prevent infection is vital for controlling outbreaks. This includes promoting hand hygiene, safe food handling practices, and avoiding contact with bats and their droppings.
Section 7. A global call to action, collaboration, and preparedness. The Marburg virus outbreak in Rwanda is a stark reminder that infectious diseases know no borders. In a world increasingly interconnected by travel and trade, an outbreak anywhere is a threat everywhere. The global community must heed this warning and take immediate action to strengthen global health security.
This requires a multifaceted approach that emphasizes collaboration, preparedness, and innovation. International organizations such as the World Health Organization and the Centers for Disease Control and Prevention must work closely with national governments to provide technical assistance, share information, and coordinate response efforts.
Investing in research and development for Marburg virus vaccines, treatments, and diagnostics is crucial. While there are promising candidates in the pipeline, more research is needed to bring these products to market. The global community must prioritize funding for Marburg virus research and ensure that any breakthroughs are accessible and affordable to all who need them.
We cannot afford to wait for the next Marburg outbreak to happen before we take action. We must learn from past outbreaks, strengthen our global health infrastructure, and be prepared to respond swiftly and effectively when the next emerging infectious disease threat arises.